Go live. Hello, everyone. This is Bob Miglani. Welcome. This is a newscast. No, it's not. It's a live stream. Hi, Jason. How you doing today?
Hey Bob, how are you?
I'm well. I dressed up fancy for you today, Jason. Look at that.
Thank you, I appreciate it.
Yes. I'm doing a video shoot later. That's why I'm dressed up, folks. I'm not dressed up for you, LinkedIn audiences. But I'm delighted to have you with us today. My name is Bob Miglani. I'm the founder and CEO of Hoot, and I'm joined by my co-host, Jason Grossman. He is a pharma executive, commercial operations, but I'll let him explain who he is. Jason, can you tell us a little bit about you, please?
Thanks, Bob. I'm happy to be here again with you. I am a 30-year veteran in the pharma and biotech world in commercial operations and patient operations.
Dressed up, folks. That's awesome. Thank you. Wonderful. Nice to see you. We know each other for a long time, and I know you, Jason, to be a very smart guy, handsome young man, and a smart guy. Really detailed, a lot of experience in sales, marketing, pharma. I myself, as you all may know, I spent a lot of time in pharma. I was at Pfizer for 23 years, and then I left some years ago. So today, what we're going to talk about is what do patients want in 2026? We're going to cover three things. The first is based on what we're seeing in the marketplace, what Jason is seeing in the marketplace with actually working in a pharma company, what I'm seeing in the marketplace, but working with clinicians, hospitals, pharma companies across the US, what I'm seeing. So live, real experience, the marketplace experiences. Second, we have some data to share. We looked at studies in 2026 and we found 5 that were really interesting about patient communication and patient understanding and experience. So we'll share those. And third, we'll have a real life patient, someone with a lived experience. And she's terrific. And she had cancer and she went through treatments and want to kind of get a little snippet, about 4 minutes, just explaining her journey. She's going to explain in her own words what she wanted as a patient. And she was with pharma. She was in pharma for 25 years, and she had to go through this cancer journey herself. And so we're going to share, we're going to unveil it here today, actually very exclusively here, to share with you her story and what she went through. And it gives you insight into what she wants. So we're going to cover those areas. So let's get into it. Jason, let's start off with this. One of the biggest changes we've seen in the world of patients is AI. Okay. Do patients want more healthcare AI? Is the question I have. Talk about that. Let's talk about what patients want in terms of AI.
Sure. So let's talk a little bit about the communication journey for patients.
Yeah.
Right. You got to know the history as we move through the communication channels.
Yeah.
Communication primarily to patients was through physicians, but with information coming from most of the pharma companies in the back end because patients get treated with medication.
Yeah.
And medication comes from the pharma companies.
Yeah.
Doctors are traditionally taught about diseases and how to recognize them and how to treat them, not necessarily on how to talk to patients. So pharma has supplied to physicians mediums, and it started with paper. We all went to the doctor and we saw brochures, and it was easy to read and it was meant for patient consumption. And then it went digital. We all remember that time where we started seeing commercials on TV when that was allowed. So a little bit more information. And that was the teaser. That was the teaser to go in, if you have this disease, to go talk to your doctor. And then it turned into the internet and electronic communications and websites. And it became more and more confusing.
Yeah.
So you have all of these different mediums of information being sent to different types of patients who are savvy with electronic medium, who want to do their research,
Yeah.
And those patients who just basically want to hear from their doctor, you tell me what I need, you tell me what's wrong with me, and I'll do it. The trust factor,
Yeah.
right? But trust factor has been waning over the years with too much information.
Yeah.
And now we're transitioning to the AI age.
Mm-hmm.
Everyone said, okay, Mr. Google, you tell me what's wrong with me and you tell me the product I need. Now they're talking about ChatGPT, they're talking about Claude, they're talking about Perplexity, and it's the next iteration of information that's getting a little bit more personalized.
Mm-hmm.
But still, the patients need to rely on their doctors. They need to rely on their clinicians to help them understand that personal touch.
Yeah.
But AI has brought a new level of interaction, which is really important. Google gave you a very clinical, very encyclopedia-like definitions of things. Everyone remember the encyclopedias? Well, maybe you and
I
I,
do,
maybe
but
you and I
not.
would.
I don't know about this generation. They don't know what that is. I remember collecting those when I was a kid. I remember it was like a $15. It was at like some sort of grocery store. It was like one at a time. You would get those. So we
Exactly.
yeah, I remember
Exactly.
that. Yeah.
And it had everything and anything you need, but it was very, very dry. It was just very clinical. Now with AI, it's personalizing the interaction and it's giving a back and forth, and patients love that back and forth. They want to ask questions, which brings other questions, which brings other questions. And I think that goes to the communication that we were just talking about and the JAMA article.
Yeah. No. So I think AI. You said a lot of good things. Let's unpack it. My sense is that patients don't necessarily want AI. What they want is understanding. And so patients don't want AI, they want understanding. And the understanding that they used to get in the clinic, in the doctor, is gone away because diseases have become more complex, as you said, and more personalized, and doctors don't have time. So patients want understanding, and they're turning to AI for a lot of this understanding. But the problem, as you said very clearly, remains they don't start. They hesitate because it's too much information. So patients typically go home and they say, well, they Google it and they put in ChatGPT their information. I know people who have an illness or some sort of condition, or they're trying to diagnose like a wart or something on their hand, and they put the photo in, and then they're having this a long conversation. Should I get this test? So there's the dialogue going back and forth between the patient and ChatGPT. Okay. And because they're trying to understand the problem and they're trying to understand the solution to that problem, they would never have been able to do so at the doctor's office. However, the problem remains. They don't start, they don't get going, they don't move ahead because it just sort of sits on their phone, or it sits there and it doesn't really do anything. It doesn't actually make you move forward in that journey. So I think that's the first thing I realized with when we're talking about what patients want is they want understanding, they want clarity. I think what about one of the things we're seeing a lot of, Jason, is misinformation in social media. So what in terms of what patients want, what are you seeing in terms of social media? How's that like impacting what patients want?
So, Bob, if you think about any disease, you can go in and depending on the question you ask, you'll get 5 favorable and you'll get 5 unfavorable responses, either through Google or ChatGPT. So, what is the right answer? It's the question that you have in your mind. Is one bad review a indictment of a whole disease or a whole product?
Yeah.
Or is it thousands of positive reviews that say, you know what, I need to talk to my doctor about that? So it's a mindset of the patients. Are they positive? Do they have a positive outlook, or do they have a negative outlook? What are they actually searching for?
Yeah.
And I think that's the key, that no matter what you're searching for, you'll find equal amounts of positive and negative. It's how do you break through that?
Yeah. The question becomes trust. I think it's
Exactly.
sort of like, so social media, I'm not sure I trust a lot of things on social media. I trust, people more than I do generally trust social media. I trust my doctor for sure, but she doesn't have time for me. So the question becomes like, how do you sift through what's trustworthy or not? I was talking to a surgeon the other day, and he said to me, he said, "Look, patients come into my clinic, they have large multi-location practices, and he said patients come into my clinic, and I talk to them about a procedure, and then they go home and they Google it or YouTube it, and what they find is procedures that were done 10 years ago or 5 years ago." And this was like a little bit more extensive and involved procedures. So they get scared. And he said, now we have minimally invasive techniques with cameras or really, really small, like, pinpoint cameras that go in, and we can go in and find the problem, repair it, tissue it, cut, or do the procedure. And, they're home, that afternoon, and they're back to work that afternoon. And so what patients are watching, it's not necessarily misinformation. It's just inaccurate information, old information. And so, there's a lot of data out there. So to your point, it's what do you trust, right? What is the source of that information? Is it the right person? Is it the right place? Is it relevant for you? Is it for your specific type of procedure that you want to do?
Right. People want to trust people, and they want to trust their doctor.
Yeah, yeah, that's right. That's
But
right.
with all the misinformation or information in general out there, it just becomes too confusing. And then on top of that, patients will see both sides and then go ask a friend.
Yeah, right.
And they'll keep on asking friends until they get to where they want to be.
Yeah,
But it's the same information or misinformation that everyone's looking at.
that's right. That's right. And I think so. What we're seeing, one of the things we're also seeing is you talked about a very good point is friends, and so what we see is, and I think a third big portion of this is there are healthcare decision makers and there are healthcare collaborators. Okay, they're not the same. Okay, so the spouse could be the decision maker. Like my wife makes all the decisions in our house when it comes to healthcare. Okay, she's a doctor, right? So I'm like, and she's scientific, she's smarter than I am. So I leave the decisions to her. I'm a collaborator in some sense. Okay. So, but even when I go to the doctor's talking to me about this procedure, etc., for either for our kids or for us, for me. And then I said, can I record you and show it to my wife because she's the one who ultimately has got to make a decision. And he's like, surprised. I mean, kind of not surprised. He's like, I know, I get it. As a guy in your 50s, you can't make decisions on your own, if you're married, you know what I mean? So it's sort of like you have to get permission. Or again, the decision maker. Who's the decision maker? Who's the collaborator? So in pharma, too often, we enroll patients in these patient service programs or in hospitals. We enroll the patient in, and we understand that there's a quote unquote caregiver. It's not a caregiver. My wife's not giving care to me. She's a collaborator. And I think there's a big word that we need to adjust when we come to patient experience. And we cannot just have the word caregiver anymore. We have to understand patients want to vet their conditions and treatments with a collaborator. And that collaborator is not a caregiver. It's your spouse, it's a loved one, it's your friend. And so whatever information that we're doing in patient services or marketing, any kind of brochures, any digital offerings, has to recognize that this collaborator exists, and we must educate and provide educational materials accordingly, right? So I think that you bring up as a friend, that friend could be the collaborator. You're like, what should I be thinking about this? How should I do this? I give an example a lot. I'm 56. I take testosterone as an injection once a week. And I started it because a lot of my friends were doing it, and they were walking me through their logic behind it. And then when I started taking it, I would take the dose, and I would get just like a little bit, like almost like it was almost raging. It was like it was like really angry, and I'm like, oh my god, this side effect of testosterone is pretty significant here. And then where do I turn to? My doctor prescribed it. She's not going to specifically tell me the dose. She's like, you got to kind of almost find it. So I have to go to my friends and my collaborators and to say, hey guys, what are you doing with those? Well, I space it out. I take 0.5 or 0.3 on this day on a Tuesday. Then I take it on Saturday and I break it up that way. I'm like, oh, that's a really good idea. So learning about all of this, we're learning on our own, but with collaborators is my point. And I think so patients want information. What they want collaborators more so than anything else. That's why Reddit is so popular, isn't it? You've seen patients on Reddit a lot or any of these social media platforms.
I think that's a big miss by pharma, quite frankly. I mean, you described it perfectly. If you think about a loved one, you and I have parents that are older now, and every time you talk to them, there's something else wrong with them, or they've gone to another doctor and they want to know what you think, because although we're not doctors, we're in the medical world, and they want to trust someone that they know. But pharma, the miss is it's always direct to the patient, and probably 9 times out of 10, it's someone helping the patient get through the challenges that they're having. And from a patient services aspect and operations that I set up, it's never looked at. All right, are you you have the disease, but who is helping you through? If it's not you, then who is it? And how do we get involved? How we get them involved in making sure that you start and you stay on the drugs that the doctor wants you to be on, and monitors you as those questions come up. Just like you said, you had your rage.
Yeah.
Right. And I think the Army wants you now. You get those side effects, and then you're just left wondering, should I stop it? Should I stay on it? How long is it going to last?
Yeah.
Where if you have, say, a co-pilot going along with you, that will give you the confidence and know where to go to ask the right questions, it makes all the difference.
Yes. Yeah. The Copilot. I love that idea. And we're not talking about Microsoft Copilot. We're talking about Copilots as a collaborator, someone who's with you. And I think that's really very important. In myopia management, which is my wife is an eye doctor, and she practices myopia management. In this case, the patient is the child. And the two people that matter who make a decision are the mom and dad. And that's actually where I got the terminology of a collaborator from, because the dad would come in and the mom and the dad's like, I don't know what you're talking about. You gotta talk to mom. And the child's sitting in the chairs, the patient. So it gets very complex. It's this trifecta, the patient, the mom, and the dad in this case. And that's where it's really, really important here. Let's switch gears, Jason, a little bit. Let's talk a little bit about the studies. I'm going to pull up now. And these are some studies that we found on our scan, 2026. We're going to go through, there's 5 studies that we want to highlight for you. Let's just talk about it. I know you're seeing this for the first time. I'm seeing this a little bit. I've seen this a little bit, and you and I talked about this, but in our notes, in our show briefing, but we're going to share on our screen a PDF that just shows a little bit of the studies, and we're going to walk you through it. And we'll share that in the show notes. We'll share it in on the post, so you'll be able to see the study as well, just so you have it. But we're going to walk you through some of these studies that we found that was interesting now, and we're gonna get into it. So all right, so I know it's hard to see. I apologize for that, but maybe we can expand the screen here. Let's see here. Maybe we can expand the screen. Maybe make this better this way, and you can make it better. There we go. Okay, so let's go into the first study, Jason. So these are 5 evidence-backed patient insights from 2026 that we found in our scan. First, patients, the main point, patients expect healthcare communications to support real interaction. This was published in June of this year, JAMA Open Network Open, or JAMA Open Network, I think it is. open source. And the study is about automated healthcare messages and expected patient responses. Okay. So researchers analyzed responses from 28,000 patients. That's a lot of people. 28,000 patients who sent 38,000 replies to automated healthcare messages. And patients use those replies to ask questions, manage appointments, request help, correct information, state communication preferences, and express frustration. Okay. What this is telling us here is that the findings suggest that patients often interpret health system messages like reminders, okay, reminders that we've seen as an opportunity for two-way communication, Jason, even though the technology was designed primarily for one-way outreach. Okay, so what this is saying is that the intention here, this is the study, the intention here is that what we're doing is sending messages to patients, but they're responding. And because they expect two-way communication. Does this happen, Jason, today? Do you think this happens today?
Yeah. Look beyond healthcare, right? How many texts do you get, right? Even from the distributors, drug distributors, CVS. Hey, Jason, you have your automatic refill available. And how many people reply back to it? I'm going to pick that up as soon as I can, right? People want a dialogue. They don't necessarily understand that there isn't a person at the end sending you that it's an automated.
Yeah.
But what this tells you is the personal touch has to stay in communication.
Yeah.
That the most effective texts, emails, whatever that medium is, should be a two-way dialogue. That is the most effective. People want to hear back. They want to give information and they want to receive information. Back and forth, back and forth, back and forth. That's what's going to make the most effective patient information and exchange.
Yeah. It's a two-way street. You're 100% right. I think people are, so the great point here, patients want two-way communication, not just one way. That's the tagline here from this study is patients want two-way communication. One of the things that we've seen is that, more and more of these automated messages don't have effective responses to it. And it really, we need to think differently because it's as Anna, I know Ana Lucia Torres Romero here commented on LinkedIn, and thank you for that, Anna, for that comment, says nothing like a personal conversation with patients, right? But what typically we do is healthcare systems, hospitals, pharma, clinics, we push. So it's a push. It's not even a conversation. It's just, let me just send you something. And what Anna's saying is there needs to be a conversation. That's what we're hearing in the study as well. So I think that's a very good point, Jason. Thank you for that.
One more point to that, Bob. If you see what's happening now, AI is now creeping into text messages.
Yeah.
Or communication. You go on Amazon now and you try to put a complaint in, and it's an AI avatar saying, "Hi, I'm here to help you. I'm your AI assistant," because every single electronic company is recognizing that two-way communication is needed.
Yeah, you need to have, and this is why, by the way, there's something very effective that we'll talk about it in a couple of weeks. I just want to plant the seeds, called RCS, Rich Communication Service, not just SMS. We're going to talk about that in a bit. But I think the two-way communication is really critical. So let's now go to the other study, the next study. So let me open that up here and we'll walk you through it. And so the second study here, patients do not share one universal treatment preference. You mean patients are not the same, Jason? Patients are not all the same?
No.
What do they want? These people, gosh, what do patients want? They want everything. So what they're saying here, this was also in open source, 2026. Let me see here. It was published in the Patient-Centered outcomes research. It's called The Patient. It's a journal. And the data points that talk about it as what this means is 2026. Evidence supports a heterogeneous view of patient decision-making. Different patients weigh effectiveness, risk, convenience, familiarity, and burden differently. Meaning that it's not just about the effectiveness. Yes, they have to weigh it with other factors. So patients just don't make decisions about the treatments based on one factor alone. They have different weights according to what their preferences are. Let's talk about this. I mean, we know this, don't we?
Right. If you've seen one patient, you've seen one patient. And if we think about drugs from 20 years ago, it was a mass appeal, and it was typically a pill. And as the science has evolved and we've gone down to more of a cellular level, there's different modes that people can get from their local pharmacy. You can get a shot, you can get, there's now infusion centers you can go to, you can get a pill. There's so many different ways to take things. But it really depends on your lifestyle. It depends on your knowledge of the disease. So as communications get more and more complicated, we get on the pharma side, we can get down to a minutia of a level to target patients based on their lifestyle, based on their disease knowledge, and based on how they generally want to take products. I mean, look at yourself. You're taking an injection. I was on a cholesterol med for a long time and it stopped working. So I had to go to a shot that I have to give myself.
Yeah.
And my lifestyle is able to support that.
Yeah.
So no matter what, the number one attributes that patients want is effectiveness.
Yes.
It's got to work.
It's got to work.
If it doesn't work, then there's no reason to take it.
Yeah.
There's no placebo effect when you have a disease.
Right. It's got to work. Absolutely. Actually, it's interesting to say that. When I first started testosterone, I was taking the gel, rubbing it on my shoulder every day. And it was kind of annoying. And I don't know if it really worked, honestly. So that's why I switched to an injection. I never would have taken it. I pass out at needles, honestly. Like when I was a kid, I passed out doing, getting blood taken. Even to this day, when I go blood, I'm like, can I just lay down? I'm a little queasy. Okay. So I don't like needles. I just don't like needles. But here I am putting a needle in my arm once a week. All right. It's like, when did this happen? How did this happen? Right. And it's interesting. The preference of lifestyle, of the convenience matters once the effectiveness is solved. Right, the weight of effectiveness versus the effectiveness of, or the. I didn't want to move to the needle, but the drug, to your point, the drug wasn't effective. That's why I moved to the needle.
And the technology with products like the needles, they're putting patient-friendly drugs in needles where you don't actually see the needle, and it's only a 10-second injection that you really don't feel. So the technology for dosage and distribution is keeping up with the technology of the actual drugs, the fourth, fifth, sixth generations of different drugs.
Yeah, they've gotten better for sure. All right, so let's go to the next study. Here. All right, number 3, patients need medical evidence presented in interpretable formats. 2026, JAMA Viewpoint argued that commonly used stats such as relative risk reduction percentages and biomarker changes may be technically accurate, but patients don't get it, but difficult for patients to interpret. The authors recommended using absolute risks, natural frequencies, contextual comparisons, and so on. So the core need is not simply more information, but information patients can compare and apply to personal decisions. Ultimately, it comes back to, Jason, what? What does it mean for me?
So here's the problem, Bob.
Yeah.
As the technology to detect diseases becomes more and more in a cellular level, and the detection tools become more and more sophisticated. There's acronyms for everything, and no one knows what they mean. They just know some blood was taken, and this is the results.
Yeah.
So it becomes completely confusing.
Yeah.
Really has to be dumbed down to the consumer level. And that's exactly what this is talking about. Doctors don't know how to dumb it down because that's not the way they're trained. All they know is that I know the cellular acronyms, I know the test acronyms, but how do I tell that to an 80-year-old or a 60-year-old to help them understand what's wrong with them, where the problem is, how I detected it, and how I need to treat it. Yeah. So pharma has to become better at, let's say, becoming more on a lower level of discussion.
Yeah, health literacy. I mean, we talked about this years ago when I was at Pfizer about health literacy. You know, I think it's really important. One, I think, you know, in our, you know, one of the systems that we work with at Hoot, you know, when the patients get the text message with the video of the doctor, there's a message that accompanies that. And we talked about this, Jason. I think you had a brilliant idea about this. Like, we need to do a survey. We need to actually ask them, do you understand? Press 1, do you understand? 2, if you don't understand. How do you, like, you don't do that today. When we send patient information out, typically pharma, it's just pushed out there. And we don't know if there's understanding, right? Patients want to understand things in a different way, right? And often they feel alone. And so it's not even just about the drug, about the product, it's about how they feel, right? So we're going to move right now, Jason. I'm going to stop the review of the studies. We'll pick that up in a second. But I'm going to bring in a patient, a real life patient now, a person with a lived experience. Her name is Natasha. She went through cancer in her journey, in her condition. She's been in pharma for 20, 30 years, a long time. And she had an experience with this journey that she had in oncology. She was very knowledgeable. But she recorded a video for us explaining her journey, and I'm just going to let the video play. It's about 3 or 4 minutes, and I just want to be respectful, so I might play it a little bit and then stop it. And we'll share all the video later. But this is so the interviewer asked her, "How did you feel after you got the first diagnosis?" And so just let's watch and let's listen.
An interesting day, to say the least. So just by way of background, I have spent my career in the pharmaceutical industry, my husband as well. We know oncology, we know healthcare, we know medicines. And walking into that room, you know, I had already known to expect that there was a cancer. The doctor pulls out a piece of paper, this big, puts it in front of me, and draws stuff and explains things to me. And before she could even get to the ending, I was relieved that it was HER2 positive. Maybe 10 or 15 minutes into the conversation, she was done explaining herself and explaining not herself, but explaining my situation to my husband and I. And asked us if we had any questions in 15 minutes of hearing this. And of course, we're just stunned. So she left. The doctor left. She was a very in-demand doctor. So I go down the hallway to meet the nurse navigator, stunned, with my piece of paper. She says, "Natasha, do you have any questions?" And I took her tissue box and I bursted out crying. I had no idea what to ask, how to ask, if she was going to help me, if my husband was going to start crying because I'm crying, if I was going to make him more worried. There were so many things spinning through my brain at the time. And wanting to be everything for everyone, I walked out of that office that day being diagnosed with stage 3B, HER2 positive, HR negative breast cancer, which required a minimum of 18 rounds of chemo. These were already on the left. They found more lumps on the right breast. And so this is like This is like 2.5, 3 weeks later. Yeah. So talk about going into two different directions, right and left. We were stunned. I have been a healthy person my whole life, going to the gym, always obsessed about my weight, keeping it in check. My mother died early. My mother died at 64, not from cancer, just complications with diabetes and just, comorbidities, but she died really young. And I had nobody after that. I just wanted to crawl in my closet in the corner, in the backest corner where all my long dresses hang, and hide behind there and just be. You don't know what questions to ask. And honestly, several years later, I go to the doctor and I still don't know the questions to ask. The nurse navigator, she knew what I wanted to ask. She answered questions that I didn't ask because she knew I had those in my mind. And I'm like, oh yeah, I was wondering that. So she had the foresight to just be proactive and help me and put my mind at ease about things, or, offer more information or tell me, what sources to go to. I wish that there was more of that, to be honest. You are a 15-digit number. You're such a small part of their world. Nobody told me specifically that after chemo 2, about 2 weeks in, is when my hair would come out. So I'm like in the shower, and then, my hair is so tangly all the time. And I'm thinking, why is it so tangly? And the hair is coming out, but it's so tangly. And I couldn't quite always get it into a ponytail because it felt so tangly. It wasn't tangly. It was actually not on my head. That's the average. Nobody told me. Every night I would wake up with horrible, debilitating muscle cramps. I still do. In places in your body that you just didn't realize the muscles could cramp. Everywhere I had muscle cramps. Like, I'm talking on the tops of my foot, not just the Charlie horse in the back of your calves, tops of my foot, at the groin, muscle cramps every night. It would have been really nice if somebody would have said to me, Natasha, it's been 2 days since your chemo. You're probably going to get a lot of muscle cramps. It's not magnesium. It's not that you're dehydrated. You just need to take this pill. It's called blah, blah, blah. It looks like this. Just take it before you go to bed so that you can have a good night rest.
Well, I really.
Yeah. So, I mean, it's a beautiful story. Thank you, Natasha, for sharing that story. And Rosa, who's a nurse who interviewed Natasha. And Natasha is doing well. She's terrific. We love Natasha. She's amazing here. We'd love to have her on live at some point. But, what do you think of that, Jason? What do you think of her perspective and her?
It's powerful.
Yeah.
Right? Everyone's been touched by cancer, but you don't necessarily know all the issues unless you're actually going through it.
Yeah.
And she's exactly right. When you and I grew up salespeople in the pharma industry, I spent most of my career in oncology.
Yeah.
There weren't nurse navigators.
Yeah.
There were just doctors and nurses.
That's right.
And you had to figure it out yourself. Nurse navigators are a blessing now.
Yeah.
But you have your good ones, you have your not so good ones. They're just as busy as the physicians, right? So there's this element that's missing of, you have this disease, and you heard her say it. I didn't know what to ask. I was just stunned.
Yeah.
Right?
Yeah.
And again, I say, as we get more and more technical, more and more issues are going to happen as we get drugs that are more and more targeted.
Yeah.
With more and more side effects. There's not enough information out there to help you understand.
Yeah.
And even if there is information out there, doesn't necessarily mean that you're going to have the same issues.
Yeah. Yeah.
So
yeah.
It's this quagmire of help me.
Yeah. Help me. I'm alone. I feel alone. And
Yeah.
stunned, alone. I didn't know what to ask. And no one told me. And the thing is, what's interesting in that example is she said, no one told me that after chemo, I would have these cramps or something, or my hair would fall out, and not hair fall. It was about the cramps. Sorry, about the cramps, which could have been, resolved, I assume, with, some communication, right? Like if the doctor or the nurse navigator or someone in hospital or pharma who's organizing, communication for patients could have just said, here's what you're going to expect. They know that. You know the journey the patient is going to get based on the data, right? And so if you know the journey, pharma, marketers, patient services, hospitals, if you know the journey, say it. Build it so that patients understand what to expect. That is what makes people so scared about healthcare, is that if you don't, they don't know what to expect. And that not knowing is very, very scary for people. They feel like,
Here's the other problem, Bob.
Yeah.
When you get a devastating diagnosis like that, it's not just the disease. You're put on 10, 15 different medications, and they all have different side effects. They all have different possibilities. So it's the disease journey and it's the medication journey.
Right.
It's a multifaceted, complicated journey that you can't do alone.
Yeah.
Because you can't think straight on half of these medications when you're on.
That's right.
That's why you need someone along with you, your influencer.
Yeah.
They, either decision maker or not, you need that influencer helping you along the way. So there's the physical aspect of it.
Yes.
But then there's the mental aspect of diseases.
Yes.
So it's this multifaceted trifecta of a fog that's around you.
The fog. Yeah, that's absolutely right. I think that's absolutely right. And I think, the fog, that's a great word for it, Jason. It's this, journey fog. It's like you're in this journey on the path and you don't see which way do I go, left or right.
Yeah.
So it's a great analogy. I love that analogy. I want to use that. And I'll give you credit for it. But
thank you.
The notion is that good patient experience managers or patient educators understand that the paths. They know the paths. Okay. We know when this treatment starts, this is going to happen. This is likely to happen. This is likely to happen. Generally speaking, right? You may not have the real world data, but you will get it. You can get it. But you have clinical trials. You have plenty of experience with the product or the therapy or the treatment, and you have a good sense of it. So we just have to explain it to people. It's really that simple. And instead of relying on ChatGPT, which pulls from Reddit all the negative, we need to be more balanced. We need to bring that trustworthiness into the journey. So the fog has to be lifted some way. So patients want less fog, more clarity as a buzzword, as a tagline. If you want to think about that, is hey, get me out of the fog. Help me. Somebody help me with this place.
Exactly.
All right, so let's go now. Thank you, Natasha. Again, that was beautiful, very powerful. I'm going to move now very quickly into a couple of more studies, Jason. We'll wrap it up very soon. So number 4, patients differ in how they want test results delivered. Okay, 2026 study of patient portal result release found that some patients prefer immediate access, while others prefer a doctor explaining things to them as receiving abnormal or emotionally significant findings. The study was in a Journal of Medical Internet Research, published in 2026, open source. It indicates that a single default delivery model may not meet every patient's need, especially for complex or sensitive results. This is actually very important in areas and conditions, I suppose, Jason, like rare disease, right? Ultra rare diseases. The doctor the patients want results fast, but you get the results, you're like, what does it mean? You need somebody to interpret them. So it becomes a timing issue, possibly. What do you think about that?
So Bob, there's a problem with this.
Yeah.
The problem is, no matter what disease, even when you go to your primary care physician, it's a timing issue.
Yeah.
Your primary care physician is probably booking out 3 months from now.
Yeah.
Your oncologist is probably booking out a month to 2 months from now. Your test results will come back so quickly that you'll have those results and you won't know what to do with them. Take, for example, you go for a simple blood test in your yearly checkup. I go to Quest. Within one day on my Quest app, I have every single results, positive or negative, on there for me to contemplate before I go back to the doctor in another 2 weeks or 3 weeks.
Yeah.
So patients want it, but they need the education that goes along with it.
Yeah.
Especially when you're getting diagnosed with a disease.
Yeah.
It's one thing to understand that your cholesterol is high, or you had too much red wine the night before your blood test, and your blood sugar is up a little bit, right? It's not just on the medication side. It's just not on the physician side, but there are so many sides of healthcare, and in this case, it's testing.
Yeah.
Right. That's another side of this fog.
Yeah.
That there needs to be a coordinated effort. And every test I go to, no matter what doctor it is, they always say to me, okay, I'm giving you this blood work. You're probably going to get the results before I do.
Right.
But we'll talk about it when you come in.
Yes.
And that could be really nerve-wracking when you're getting a disease diagnosis.
Yeah, for sure. I'm a bad patient, I suppose. I call the doctor and my primary care doctor, and I say, hey, can you send me the script for the LabCorp blood test? And so they send it to me. They put it into the system. I go get the test, and then I get the results, and immediately, like you, I get it on the on the app, and I put it in ChatGPT or Claude. I'm like, look at it, and tell me this is what's good, bad, and ugly, right? And it tells me. But guess what? The doctor is trying to reach me and trying to say, hey, make an appointment to come in, the staff, and I haven't done it yet. And it's like 3 months, and it's sort of like, do I need to go to the doctor? I kind of do. I have 1 or 2 questions, but again, it's one of those things that and this is, again, a very simple thing, which is we're relying less on the doctor because we're not sure what understanding we're going to get from them. And the truth is there could be really detailed understanding, looking at patterns based on what they know. But again, ChatGPT has changed a lot of this, in terms of like what to expect. But for serious and rare diseases, I suspect that you're right, that there has to be a better timing of the doctor explaining it. So immediately upon the results, there has to be some sort of communication. Could be a video saying, hey, this is what we found, and this is what it kind of looks like. So it could be a very simple video of the doctor reviewing the results and sending a video, shooting the video out to the patient, saying this is kind of what we found. Let's schedule a call, and we'll talk about it in more depth. But that's something I remember in the old days, doctors used to call and leave a voice message saying, hey, your test came back. Everything's fine. Have a good day. And
now you get that on my chart. Everyone has on my chart, and the doctor will send you a message there. It's probably the nurse doing it, but
yes.
Hey, your test results are in. Make an appointment, or things are good, or do this or do that. I'm calling it a prescription.
Right.
So it's this instant electronic communication. Yeah. But it's not coordinated. And that is a problem.
Yeah.
And most doctors, if you go in and you ask them where they spend most of their time, it's writing the truths or the negatives or the wrongs that patients are getting off the internet and coming in and going, oh my God, I have this.
Yeah.
Oh my God, this thing happened with this drug. And the doctor spends a lot of time saying, oh, that might have been that person. It might not have been you.
Yeah. Yeah, exactly. Exactly right. All right, let's do one last study, Jason, and we wrap it up. So let's talk about the next study here. The next study is number 5, acceptance of healthcare AI. Again, we're reviewing studies. We found 5 studies in 2026 that were really interesting to share when it comes to patient experience. We're sharing some of the findings here. We'll share this document with you as well. Acceptance of healthcare AI depends on trust conditions. The systematic review 2026 found that common barriers to patient acceptance of healthcare AI included privacy, data security, transparency, accountability, unreliable results, and loss of human interaction. Common facilitators included demonstrated accuracy, clinical involvement, understandable explanations, and perceived usefulness. This was in the Journal of Medical Internet Research. Essentially, what we're seeing is it means is patients are not uniformly pro AI or anti-AI. Their acceptance depends on the use case and whether the system appears safe, understandable, useful, and accountable. So it's not, what do you think, Jason? They're not anti-AI or pro-AI. They're just more pro-patient, I suppose, or pro-understanding.
I think the whole key to that study was, and 2 words, clinical involvement. Mm-hmm. It's no different than going to Google or going to Reddit or going to your best friend. It's a source of input of information. But until that's validated with a clinician that you trust, and it goes back to trust. Yeah, who do you trust? There's so much positive, so much negative information. That's where we started this whole conversation. There is so much information out there, positive and negative. Yeah. But until you sit down with the person you trust to help you make those decisions, it's all noise. It's the fog that we talked about.
Yeah, the fog. Yeah, I have someone I know recently got some diagnosis with some condition, and he's struggling with it because he put it all into ChatGPT, and he got a lot of information. And he called me and he said, "Hey, I'm trying to figure this out. What do you think?" And I'm like, "Well, let's put it in chat. My Gemini, what does it say?" And this, that, and the other. We're like going back and forth. And it's like, I just like, can't we just talk to a doctor? And he goes, "Well, I went to see a doctor and at 15 minutes, and I think I got some answers, but then I got a note back in my chart saying, don't worry about it." And I'm like, "What do you mean not worry about it?" Like, he's like, he's very confused and he's overwhelmed. And it's because you're right. There's too much. And human beings want crisp clarity from a trusted source. And that trusted source happens to be the doctor. And, yes, he's had massive, exposure to AI and ChatGPT and lots of data, lots of input and going back and forth. It's become a friend of his, if you will, right? A lot of us. But it always goes back to he's unable to move forward. He's stuck because of too much information. That's typically what happens. When you have complexity, people freeze and they don't know which way to go. And the only way to get the nudge the only way to get nudged forward, when we're talking about nudge theory here, is their doctor nudging them saying, "You know what, I think it's fine." Or, "I think, this test would be useful." And somebody else saying a path that is clear to you with an understanding of you. And that is what is missing, is that, "Hey, I think this is a good path for you." AI is not going to do that. It's going to kind of wishy-washy around it, right? It's just going to give you all this information. So that's, I think, one big problem that we're seeing is that it's just that people don't move forward. They get stuck with complexity. And when you have more complex diseases and complex paths and treatments and more variables, you just freeze. So I'm really afraid for this next generation of people, and all of us here, who are using AI on a day-to-day basis to not get clarity, Jason.
Right. AI is on the surface, could help provide clarity, but it's when you get stuck and you keep going back and back and back. Yeah. And then you're getting conflicting information, or you're getting information from one of the AIs that says, "I don't have enough information," or "I'm not a doctor."
Right.
AI will tell you, "I'm not a doctor, but here's some information."
Yes.
Right? The fog just becomes thicker and thicker and thicker until you can have that personal interaction, either live, through my chart, whatever it is. The fog will just stay there.
Yeah. For sure. So let's wrap up, Jason. What are your top 3 if you will, takeaways from what patients want, from what you heard from Natasha and her story of going in this lived experience, going into this condition of cancer, and then coming out of it. But, just that from the studies and from your own experiences. We covered 3 areas, folks, today. Our professional experiences, seeing what's in the marketplace, what patients want, studies that came out this year, and then a patient perspective. So what is your, let's say, 2 or 3 things that you think patients want?
Number one, two-way communication. Patients don't want to be dictated to. They want to be able to have a back and forth, a personal conversation, whether that electronic or preferably live. Number 2, effectiveness of drugs always win. And it's your lifestyle that helps you understand how to take that drug.
Yeah.
And number 3, there is a severe fog because a lack of personalized communication by HCPs, they just don't have the time.
Yeah.
And because of the availability of information, positive and negative, is just creating a bigger fog, a bigger challenge for HCPs and for patients. Those are my top 3.
Yeah, no, I love that. I love the fog concept here, Jason. I think patients are in a fog. My sense is, for me, there's a lot of uncertainty. The fog implies uncertainty. And we see a lot of uncertainty in conditions in the treatment journey. And I think the big one for me is give me a sense of what to expect, okay, in this journey. Give me the roadmap. Give me a plan, not just like the drug plan, but what I can expect, ups and downs. Will my hair, do this? Will I have cramps after chemo? Right? It's what Natasha says. No one told me. That really struck with me. No one told me this was going to happen, but they knew, and they didn't tell me. And they maybe dismissed it because it's not a big deal perceived to them, right? But the patient thinks it's a big deal. So to me, the big one is tell me what to expect or what I can expect in this patient journey, in this journey that I have going on, right? And a lot of times, for example, in certain pharma, and this in specialty pharma, when certain side effects are there, it means the drug is working. And sometimes the side effects are absent. So patients don't know what to expect with side effects. Maybe it mimics the disease more, and you're like, wait a minute, this is not working because my disease is not going away. Well, actually, maybe it is, right? So disease with personalized medicine today. So there's a lot of uncertainty patients face and what they expect from their doctor, from their health system, the hospital, the clinic, or the pharma brand that makes that very expensive $300,000 therapies. They want the expectation. They want to know. And they want to know in a timely fashion to lift that fog, to make it clear for them. It's already difficult. The journey is already difficult. Why make it worse? Why confuse me with this fog? So with that, I'm going to close our session. If you have questions, let us know. But we had some great responses and comments. And I just want to say thank you for your time, Jason. I hope this was useful for you as well as for me. Any last thoughts that you want to share, Jason? Might be helpful.
Bob, it's always a pleasure to be with you. And thanks for dressing up for me. I really appreciate it.
My jacket here. Yes, thank you very much. I appreciate it. So, Jason, thank you very much. Everyone on LinkedIn and wherever else you're watching this, my name is Bob Miglani. I'm the founder of Hoot. We design and deploy digital patient experience, patient education that is doctor-led, trusted, and video-based. And I'm delighted to be with you. We work with hospitals, pharma, and clinics. Jason, pharma executive, 25 years, 30 years, commercial operations, market access, patient services, et cetera, medical affairs, and so on. Actually, you didn't do medical affairs. I did medical affairs. But anyway, in pharma. But Jason, thank you so much for these insights. Really grateful for Natasha and for sharing her journey and for everyone joining us today. Thank you very much. Have a great day. If you like what we did, like it and comment about it. All right. And share it around. Okay, folks. Thanks very much. Have a great day, everybody.
Thanks, Bob.
Have a good day, Jason. Bye.
Mm.